So here in New York City, the lines for the COVID test are literally around the block. But that being said, everybody's got a mask on outside, and that's something new. But all that being said, it just feels like here in New York, and maybe elsewhere as well, that people are just saying, I'm going to live with this variant. I'm not locking down. I'm not shutting down. How do you think about this variant and how, the response should be?
Well, I think everybody should do everything they can to stop or slow the spread of this variant, because with the numbers that we're seeing, eventually the healthcare system would be really stressed out. And so we really need to think about even, if possible, wearing a mask, distancing, good cough etiquette, and also hand hygiene, washing your hands as much as possible. If only to for personal safety and also for not compromising the healthcare system, so that those who need care can really get it.
What kind of data do we have on Omicron now, doctor? I mean, do we know, for example, what percentage of Omicron cases end up in the hospital? Because people are dropping like flies, or rather, they're getting infected left and right, but not really dropping like flies. In my anecdotal experience, everyone seems to be getting it, but nobody is going to the hospital.
Yes, so I think that right now, because many people are doing rapid testing themselves, they may not necessarily report them to the authorities. So our case rates are actually not as accurate as before when we had everyone going to testing centers. So then in terms of estimating the percentage of those who are infected going into hospital, that estimate is not going to be as accurate. But we do know that even with these amazing case rates, we're not seeing the hospitals being overwhelmed the way they were at the beginning of this pandemic, with quite a few people being sick and have severe disease. And also, I must say that for those people who are vaccinated, even though the Omicron may be not as susceptible to the neutralizing antibodies that are induced by vaccines, the vaccines still protect against severe disease and death. And so I think that we are fortunate in that respect, in that many people are being vaccinated or plan to be vaccinated, and quite a few people are already getting boosters. And so,
do you know how many? Do you know how many days after getting this, roughly, that you're still infectious, that you're still liable to give it to somebody else? Because we just had new CDC guidelines, and they've reduced the amount of time you need to stay home if you're asymptomatic from 10 days to 5 days. Does that make sense?
Yeah. Yes, I think so, and that's being if you're cautious in the beginning of the pandemic for the virus, we said that you could be infectious and pass the infection on to others 2 or 3 days before you're symptomatic, and maybe you could be infectious up to 8 days afterwards. But then, most of the people are most infectious within, 3 to 5 days after the onset of symptoms. So I think CDC is recommending 5 days so that, allow the economy to recover, allow people to go back to work. So it's a balance between, risks and benefits. And so I agree with the CDC recommendation to cut the isolation by half, up to 5 days, because you now averted the period when people are most infectious.
So, Rosanna, when we get to the end of this Omicron variant, are we going to be left with maybe two populations out there? One population that's fully vaccinated, boosted, and all that type of thing, and generally has some pretty decent antibodies, and then the other population will be those that have, in fact, been infected? Is that where we're going to be?
Yeah, I think that's the scenario. And then, I think as this virus eventually becomes one of the endemic seasonal coronaviruses, eventually everybody will get the kind of transient immunity that we see with common cold viruses. And hopefully, maybe that the vaccines will keep up the way that we keep up with flu vaccines every year, so that we have better immunity against common cold rather than the way that it had been before this pandemic.